peg-shaped teeth, they can be, your treatment can be integrated sensitively within the overall treatment plan. You can communicate with the major cleft tip and you can consult them and you can always integrate your treatment into it. So, mixed dentition stage around 7 years, teeth in the cleft region will have rotation and microfibrillation, anterior, posterior crowding, hypodontia, class 3 insider relationship. Missing teeth will be 50%, supernumerary teeth will be 20%, hypoplastic teeth 30%, malocclusion 100%, and dental cavity and gingival. So this sir has already shown you the preocular bone grafting. Somebody was asking question. That is, it is done at the alveolar bone grafting. It is done at the age of 7 to 9 years. And end of the dental growth, orthoplastic surgery or distraction stage analysis for maxillary advancement is required. Okay, and then later on, after post-orthodontic treatment, placement of the implants or fixed teeth, etc., for the missing teeth will be done. So this is again that bone grafting for the closing the oronasal fistula. Okay, so again we follow the tissues from the palatal side. We close the fistula as well as we follow from the labial mucosa. Right after modifying, then the bone graft is put in between and the suturing is done. So the oronasal communication is eliminated after the orthodontist expands the jaw.
Just wanted to ask you for this entry and exit.
Now this is the procedure which Dr. Narmanda has already shown you beautifully. These are the X-rays and you can see the canine is grown into the bone graft.
Just want to ask you for this entry and exit marking is not there.
So this is
It's there.
But nobody was there when I entered.
they have left gap.
Okay, I'll see.
We have that and that gap will be filled up by the prosthesis. Next. This is for the bilateral left lip patient. So the more or less same procedure but bilaterally done to close the oronasal communication and bone grafting is done. And if the child doesn't go during that period to the orthodontist, then this is what will happen. The upper maxillary jaw will be totally hypoplastic. It will have V-shaped, typical narrow maxilla, collapse arches, malocclusion, and crowding, lot of crowding, and class 3 pseudo, class 3 prognathism. The mandible will show.
एंट्री मार्क करने के लिए कोई नहीं था यहाँ पे, लेकिन उन्होंने बोला कि कोई था। 3 बजे से कोई नहीं था।
मॉर्निंग से कोई नहीं।
अच्छा, लेकिन वहाँ पे
वहीं पे।
और यहाँ पे
हाँ, यहाँ
लेकिन ये लेक्चर 3 बजे शुरू हुआ कि उसके पहले?
ये अब उसके पहले 2 बजे का है ये लेक्चर।
2 बजे शुरू हो गया?
हाँ, ये 2 बजे का है, 3 बजे वाला अभी ये इसके बाद है।
अच्छा, लेकिन अभी 3:30 हो गया।
वो लोग क्या कर रहे हैं अपने में, हम लोग कुछ नहीं बोलते हैं।
Now there you can see this print which is prefabricated and the upper teeth will be fitted on the lower jaw. So the occlusion can be near normal. Okay. So by orthoplastic surgery we can divide different segments. We can divide maxilla into 3-4 segments depending on the need and we can set them right. Next. So this is the typical unilateral cleft lip patient. Here we do the report back osteotomy and after doing the osteotomy of the jawbone, here we divide the maxilla into 2 segments because deformity is unilaterally and this is after, mind you, after orthodontics is over. When the jaw expansion is done, teeth are level and they are set right in the dental arch. But they are not dental arch. Orthodontist here does not coordinate the dental arch along with the mandible. The oral and maxillofacial surgeon advances the maxilla by doing the osteotomy and fits it into the place. And this is how the maxilla can be divided. And this is how it is fitted as per the lower teeth. Next.
entry for me for
And
this?
again, we prepare a pre-fabricated
I'll bring my card.
guide on the slit and we set it right in relation to the mandible.
No problem, no problem.
So traditional orthodontic surgery and craniofacial reconstruction, it has got several limitations in the treatment of severe congenital deformities, which
क्या मैं
involve
लेक्चर का नाम
large
क्या?
skeletal
लेक्चर का नाम
movement.
what is the name of the lecture?